therapist goes to another therapist for their therapy?
Yeah,
They do, right?
yeah.
I had this question.
There's a joke like McKinsey goes to BCG for consulting, right? Company, how to make McKinsey better than BCG. So they referred BCG to come.
Hi, Abhishek.
I'm
I'm Ravi.
Action was the Hi, this is Abhishek. Welcome to Rekindle Club, and this is Revise with Rekindle, the greatest podcast ever made. Conditions applied.
Tanvi, welcome to our podcast.
Hello, Abhishek.
How are
Thank
you?
you for having me. I'm really good. How are you liking Nashik?
Nashik is wonderful. I love the city already. I mean, it's wonderful. Very quiet, very peaceful.
Great.
And of course, there's wine, so I'm not complaining.
Yes,
So, a little bit about you. If you could tell our audience, like, what do you do, what are you doing, how are you practicing?
Sure. I have completed my post-graduation in psychology, and I'm working in this field since 2019, and I'm practicing privately since 3.5 years.
3.5 years.
Yes.
Oh, wonderful. And how has been your experience?
It is wonderful. The response is overwhelming sometimes, and I'm really glad that response is overwhelming, because that means that mental health is getting destigmatized, and awareness about mental health is increasing, and people are actually coming forward and asking for help, even though they are not suffering from any disorder. Still, they know that they need to approach a psychologist in terms of emotional problems, behavioral problems, and all age groups. So that's really wonderful.
It's interesting you say that. But if you have to ask you, what is the demographic split like in terms of gender? What would you say in terms of numbers? What would 60%, 80%? What would that be?
I wouldn't go for numbers, but I would say that yes, female clients approaches us more, and comparatively male ka number kam. Yes.
But ऐसा क्यों है? Why do you think that is?
I think that is because of the social conditioning. Boys have been taught like that. If you don't show your emotions, then you are a strong person. And there's always this pressure of to be manly, to be strong, to be the protector.
Right.
Always, right? That's why I think the stigma related to men's mental health is more as compared to females.
So that is particularly one of the reasons why men don't come to less in terms of quantity.
Yeah. They only minimize their own problems sometimes. That is also good. So society minimizes their problem, and they also have been conditioned to do the same. So they don't approach very readily. But the scenario is changing slowly. That I can say.
You can say that men are coming in more.
Yes. They are coming in for more. At least they are inquiring. Okay. And they do come in when they go through breakups and all that stuff. A very small portion of male visit for for self-awareness.
So if there were top 3 reasons why men visit you, what would that be?
That would be career.
For their career?
Yes.
They come to you for career counselling?
Yeah, well? No, not career counselling, but because of COVID, there's a work-life balance is disturbed.
Okay.
Right? So they come for that.
Nice.
Then there are anxiety problems or mental health disorders. They come for that. And breakups.
Yes. And when you say breakup, it is like younger men coming or older men coming. Like what would be that age group?
I have been working with clients who are in the age group of say 13 to 65, but usually the men who come for consultation is in their 20s mostly.
So it's a younger
population.
phenomenon so older men, say a 35 or a 40-year-old man doesn't really come.
No, not very much. Hardly 2 to 3 clients. That's all. Yeah, and not related to dating problems or
not related
to dating problems, not related to marital problems. Women approach more regarding that.
Marital problems.
Yeah, marital problems or couple counseling. Or what I see is they both understand that there is a problem in their marriage, but who approaches for consultation is always the women. Yes.
Women, okay.
They will come forward and say that, we are going through such and such problems. So what should we do? Like, shall we come for couple counselling? Shall we come individually? What should be the process?
So, can you derive that because of this phenomenon, this activity, women want to work really hard on their marriages as compared to men? Would that be a desirable outcome, opinion?
No, I won't say that. I would say that women are, yes, they are more sensitive. They feel things or maybe like emotions more than men, or maybe express it outwardly. That's why we know that they are very sensitive about it. So, and they want to give this chance to their marriage.
Understood.
Yes. So they don't want to take a rash decision. And I think if we just look at it very deeply, it's stigmatization of divorce in general. So, like, if I'm married to someone and if I sense that yes, I don't want to stay with this person, I will still try to push it to an edge. Okay, so
But that should affect your mental health.
Yeah, that will affect, and that does affect mental health. But in general, they will try to do all the things that are possible to save this marriage, no matter how much abusive it is, no matter how much problem they are facing on their own personal level because of the relationship. But I think this is the deeper reason, like, it is so stigmatized. If they go forward and just tell their family that we want to get divorced, the female will be told that, no, just,
It's a lot of family pressure.
Yeah, there is a lot of family pressure. And if you get a, say, opinion of the third person or a professional that yes, this problem exists in the marriage and divorce would be suitable for you, or like, this is how you can proceed. So they get more empowered, I would say, and that's what they need, the courage.
So when they come to you, do you provide that empowerment or that belief system behind taking any kind of decision, or do you tell them, like, obviously it's case to case? I mean, there is no right answer to it. But do you tell them, you should stick to this marriage? What is your suggestion?
Therapists don't give advices.
They don't give advice.
No.
This is the first. I did not know that. So,
no, yes, it's usually misunderstood. Like, whenever you visit a therapist, a psychologist, a counselor, so it is assumed that this person will tell us what is right and what is wrong. But frankly, this is not our role. A therapist's role is to, make that person aware that what kind of problem actually is there. So the problem statement, what is the problem statement basically? What can be the alternatives to solve this problem? If you choose any of these alternatives, what will be the consequences of it? And to face those consequences, what skills you will be needing. So if you need some psychological skill in that manner, a therapist will facilitate.
So just for an example, suppose somebody comes to you and say, my husband is beating me. What do you tell?
Yeah, then it is a clear case.
Then
it's a clear case of abuse.
Okay.
Right? So I'm not the person who will just, go forward and tell her that, get out of this marriage. But I can tell that person the pros and cons of it.
Okay.
Yeah, I can tell the pros and cons. Because, see, no matter how much I want that person to be out of that marriage, they still have some feelings, attachments, and I just know the 10% of it. Only from this one person.
Right.
So I cannot just go and readily say that अच्छा आपको मारपीट हो रही है तो आप छोड़ दो. No, I can suggest some ways. Maybe like you can approach a lawyer, you can bring your family in, we can talk to your husband or wife or whoever it is. Then we can maybe proceed, and I can be just a facilitator. I won't be taking a decision for you, and that is very clearly stated in sessions whenever the client asks.
Interesting.
Yeah.
So, as a psychologist, how has been your journey in terms of people accepting your profession, like your family members, your friends? Like how is it going?
That's an interesting question actually, because I remember that when I was a child, I did not know that this subject existed.
Of course.
Okay, No one.
Even I.
Yeah, it's very new concept.
Science, maths, pretty
That's
much
all.
it, yeah.
Yes, absolutely. So when I came to college and I was introduced to this subject, it was really fascinating and I could relate to it because I knew that I was interested in human behavior, but I thought back then it was really weird of me as a child to think about all of these things. Like, you know, I was like, in my childhood, I was like, why do people behave like they behave? And then suddenly I will just, answer myself that that's how it is. There's no answer to this. It is just natural. And when I came to college, I got to know that there is this whole community that, that is filled with these weird people who thinks the same. Like, there are people who are curious about other people's behavior, and there are actually mental health problems and all that stuff. So fast forward, I just completed my graduation. I got really fascinated and I decided in my graduation that yes, this is what I want to do as a person all my life. Okay? And as much as I was unaware of this, my family was unaware of this. Correct?
Yeah.
So they thought that psychology is an interesting subject, no doubt. My father studied psychology as a graduation subject, so it was okay. But they always thought that, in this field, the only job that is available is of teaching. So you learn psychology and you teach psychology. That's the extent of this field.
Did you know that this is not the case? There were other avenues as well?
Once I started studying and there were professors and I saw them having their own private practices and they were also teaching and doing all this stuff. So I knew that there were different opportunities, and in the curriculum of psychology masters or in bachelors, you are told that these are the fields you can work in. So in graduation, you got to know that there is a different altogether field of health psychology. Okay. Educational psychology, engineering psychology, industrial psychology.
I did not know that.
Sports psychology. So there are so many different fields in psychology itself.
What did you choose?
I chose clinical psychology because I was more interested into mental health disorders, and I thought that it would be really great if I could just provide help related to mental health issues. So that way I think I was really empathetic in terms of understanding.
How was the family, if you are doing it now, I'm sure now they are proud of you, but when you started doing it, how was their reaction?
I was questioned every 3 months that what are you doing? What is the scope of this?
Scope is there money?
Yeah, is there money and are you gonna be able to make a career out of this and what is happening? Because they have seen me as a student who is maybe above average, who got nice marks and academically I did well. So they thought that I should go for UPSC and civil services and all that stuff because I have taken arts. So आर्ट्स करने के बाद उसमें भी आप थोड़ा एक्सीलेंट साइड पे जाओ, आप ऐसे कुछ भी चूज मत करो. So I was questioned many times that what are you going to do and is there money and this is just a social work, so you won't be able to get successful into this and that. All that happened, but I was really adamant that I want to work in this field because I knew about mental health problems and they did not. So I could understand that their knowledge related to it is very restricted. So it's okay. I did not explain them much. I just did my part. I studied well. I got my first job right after passing out, and I worked as a school psychologist, and there I got a chance to polish my skills as a psychologist because you read a lot about being non-judgmental, being empathetic, and not giving advices to be a psychologist. So these are all the skills that you learn when you're doing your post-graduation. But you just read about them.
Did it change your personality?
Yes, it did.
How did it change before pursuing psychology afterwards?
I would say that before learning psychology, I was this idealistic person. Okay.
Black and white.
Yes, for whom things were really divided into this and always holding that moral ground and this is good, this is bad, this is right, this is wrong. Once I got into this field, that changed 360, and I'm glad that changed in 360 because I am now more open about listening to perspectives. I'm more open to my own emotions and thoughts. Now I can, be okay with, okay, I'm having this difficult patch and I'm going through this difficult patch and emotion. I'm okay with it.
Nice. Okay.
If this was the case earlier, I would have.
So you can have a third point view of your emotional.
Yes.
You can disassociate your personality and then look at.
I am learning.
You can self-diagnose your personality.
Not self-diagnose. I would say that yes, there is a lot of introspection that is happening after learning psychology. Earlier, there was the same, but now I have a technical knowledge background about it, so I can connect the dots very easily. Earlier, it was like I mentioned, this is how it is. That's what the answer I gave to myself. But now I can explore more into that.
So in terms of quality of, not quality but kinds of people that have come to you, do you say no to patients as well?
Sometimes I have to.
Can you give an example?
Yeah, but that is not dependent on the how the person is. That is not dependent on that. It is very professional. First thing is, if I don't have enough slots, then I don't.
Right, that is of course.
I then refer them to other people. And see, it's a healthy practice to refer to other people, like other professionals or other psychologists. Because, like I told you, there are so many aspects and subfields in psychology. So sometimes, if a kid comes to you, very recent example, a 3-year-old kid came and he was showing some symptoms of ADHD, that is attention deficit hyperactivity disorder.
I have a theory on that, but we'll discuss later.
So he showed some symptoms like that, and as he was 3 years old, I thought it would be beneficial for him to refer to other people because he would need medications along with counselling. And for a 3-year-old kid, you need behavioral therapy, you need speech, you need occupational therapy. So it's like a combination of all those things. Then we can provide functional life to that child. I won't say normal because he is normal. It's not his mistake that he's going through this. Okay, it's genetic. So I would say that this all will facilitate to have a functional life, and that's why it was necessary to refer him to other psychiatrists and other people who are working in speech or occupational therapy.
When coming to kids, I mean, the kids get affected by a lot of stimulus, right, around them.
Yes.
So, but when it comes to divorce or in the house when the parents are not happy with each other, do you think that causes a lot of mental turbulence?
It does, to a lot of extent. The problems are between the couple, but the impact is suffered by everyone who is a part of family. So, if parents are in a very abusive relationship, then a child might go through a lot of trauma. Then they might, face attachment issues, trust issues, and as they are looking at their parents and their marriage, this can form their views about marriage and relationship in general.
Correct.
Which is very harmful because this is just one aspect of it, like one side of it, and not all marriages or not all relationships are like this. I would say that this is my personal observation again, that many young people are facing this fear of commitment. Because they see that, how this...
Do you think it comes, it boils down to their experience when it came to their parents? That's why they are feeling...
Yes, very much. That's why. That, they see that, कि commitment में रहने के बाद क्या होता है. ऐसा उनका mindset बन गया. अब वो जरूरी नहीं कि वैसा ही बात है. Correct? But they think that, if this is how commitment looks like, then I don't want to get into this. Right? So they will maybe get away from... very good relationships, very good attachments, healthy attachments, and that is a little bit disturbing for some people because you Now you think that it is good that you're not committing to someone, but there comes a time that you feel lonely, and then the whole circle and the loop of events happen, and you
Right.
just get into very difficult coping mechanisms, and it just ruins more and more, and it can affect your functionality.
When somebody comes to you, he's a divorcee or separated, what kind of, like, what are their personality types after a divorce or after a separation? Like, how do they behave? Is there a change in their personality? Like, what do you think happens?
I would term it as a personality, because a personality is something that is very, very much static. It's not dynamic, like वो अचानक से ऐसे change नहीं हो जाएगा. But I would say that there will be some emotional problems they will go through, some of the behavioral problems they will go through. Emotional problems meaning, they will be either grieving the loss of the relationship or the loss of a person, in terms of being a widowed. Okay, and sometimes there is anger, there is sadness, there's a lot of loneliness. For obvious reasons, yes. There is disappointment also. Sometimes anxiety and fear about will they find love again, or maybe will they find a partner who will understand them and accept them for who they are. So there are a lot of emotional problems they will come forward with. I had this one case where she was a divorcee, and after divorce she was okay. I mean, she was not grieving the loss of relationship, but what happened with her is, when they divorced, her daughter was with her father, right? So my client's husband, and that was really traumatic for her, because the daughter decided to stay with the father, and it was really bad for her, and it's still very bad for her now also, because now her daughter is a teenager, so you cannot actually force her to stay with me or something like that. So she is getting this resentment from her daughter, which is very, very traumatic for her.
What do you suggest? What did you tell her?
I told her that you have to create a safe space for your daughter, because eventually she will come to you in some or the other form, maybe not in form of permanently staying with you, but there will be time when she will be coming forward and talking to you, and at that time you need to work on your emotional problems. You need to provide her the safe space. Correct? So for that you need to make changes in yourself, because after divorce or before divorce she was going through some behavioral issues like aggression, and there was a lot of yelling and disappointment and all that stuff, which obviously scared the child, and that's why maybe she decided to stay with her father, but she don't know the whole story. She's just judging her parents based on the behavior, right? She don't know the actual story, what happened, why her mom decided to do this and all that stuff. So I think
she must be very close to her father, and her father would have taken good care of her. That's why she decided.
That was not stated in the case history, because the reason for being divorced is her husband was not available most of the times, and he was not earning. He was engaged into some other behavioral issues and problems and all that stuff. So he was not there for the daughter as such. She was there, but when she is there for her daughter and her daughter rejects.
Why do you think the daughter rejected? Why do you think that?
I think now as a child, you look for pampering. You look for the easy options. So if she would stay with her mother, the mother would
be strict mother and
not strict, but she would tell her to study and not engage into different stuff. I mean, there will be more protection, restrictions. But with her father, it's not like that, because again, the father wants the custody, so he'll give all the pampering she needs. So for a child, it's just based on the pleasurable situations. That's all. They don't think much about it. So yeah.
Do you think couples should live in together with their in-laws, soon-to-be in-laws, before getting married?
That would be really interesting, I think. And there's this movie, in Marathi called Chiva Chi Sauka. This similar concept is there, like, the girl who is supposed to be married with this person, the boy, she goes and stays with his family to just see that, how it's working, and will her career will get affected, and how she will bond with, the in-laws and the husband and the habits, basically. Correct? So I think it would be really interesting if society would start accepting this new norm of just
Living
trying this live-in type of situation before getting married, so that they can take an informed decision, basically, and not regret it later, of course, because going through a divorce process is much more taxing than just taking decision beforehand.
I think we're way too behind that. I think Indian society would not allow that you live in with your in-laws and then you get married. But hopefully we reach that point.
Let's hope this happens.
We reach that point.
India is, Indian people are accepting living situations and people living together. Even the Supreme Court have now said that, like, people who live in together or like friends can be called as family. So that's really great, I think, and let's hope this happens too soon.
Sure. So the context of dating, and we have multiple dating apps.
Right.
What is your opinion on dating apps? And have you ever used a dating app? You know friends who have used dating apps?
I have not personally used the dating app, but yes, my friends do use it, and I think there is a positive side to this, that as an adult, it is very difficult to go and just meet people,
Especially a working adult.
Working adult, right? So I think it's really great that these dating apps exist. Of course, they have their own cons and all that stuff. But talking about the positive
In terms of access, I think it becomes easier.
access to that, and that is great.
What are the cons? What do you think are the cons?
Cons, I would say that on dating apps or social media in general, either you can have this whole new personality,
Which is not yours.
and you can just pretend to be whoever you wish. Okay, so you want to pretend this, secure person, a safe person. You can just pretend very easily. Okay, and then there is second extreme to this, that you can be really, really vulnerable on it, without any fear. So
Interesting.
yeah, these are two things, and I think when people go to these two extremes, then the calls start, coming up.
Not too much pretensions and not too much
vulnerability, because I have seen cases in both extremes, basically. So a person who is really, really attached to this person whom he met virtually, and in just 2 months, they will share everything about each other, and then suddenly they realize that they will not be able to meet or maybe commit to each other, and then there is this attachment issue. Now what we do with these feelings? And we know that we should just drift apart, but it's very difficult. It's creating a lot of anxiety issues for me. It's I'm having panic attacks because of this and that. So I think too much vulnerability, then like this, there are no boundaries.
How do you think we should moderate it? So I'll come to my app that I have also. We'll plug that too. Although with a Bumble background, it makes no sense, but we'll plug that too. But how do you think? How do we avoid that on a dating app? Like, what do you think we should do on a dating app? Like, what would you do if as a
in a dating app? I won't think it's a problem in the app.
Of course.
It's the individual.
That is true for any social media.
So I think what people need is guidelines, in terms of how to be on dating apps, basically. Correct? So maybe we are having this podcast and we are talking about mental health in general. We are addressing this topic how it is on being on dating apps and what are the pros and cons and everything. This exactly is the guideline that people need. So more podcasts, more videos regarding this, more awareness through social media platforms can be a
But
really good.
what would a person on a dating app should ideally do? Like, obviously, you should avoid pretense. You should not be
Right.
pretentious, or
Right.
you should not be vulnerable.
Right.
Like, is there a 50% line where you have which is a between line? Do you think there is a between line?
Yeah, but it is different for everyone.
Right, of course.
Like everyone will decide for themselves, and I think for that they need clarity that why they are there on the dating app basically. Okay, so if you are there casually, then be okay with it and
But do you think
So
girls would admit if they are on a dating app for casual relationships?
now they do. I think
Now they do.
yeah, very easy,
Yeah.
and it's good. It's really nice
Yeah.
that they do.
I mean, boys definitely are on. Most of them, as I've been
Yeah.
told, that
Yeah.
they are there for casual hookers, but they don't acknowledge it anyway.
Right.
I was talking about girls because girls, I don't do it either. Even if they want to hook up, they will never be explicit about it. Generally, that's what I thought.
Yeah, but I think that is changing now.
Okay.
Now people are okay with this. They suggest each other that get on maybe some dating app and you can find a relationship or maybe a person, a friend or a hookup, whatever it is.
Nice. So, what do you think of Rekindle? Rekindle.
Actually, when I first heard about it, I was really fascinated because it's a really great initiative. First of all, that you're trying to build a platform for divorcees, widowed, and separated people, and it is a very exclusive platform, right? Where these people will only come and maybe this is a suitable platform for them.
Yeah.
So the exclusive part I liked very much, and the initiative is really nice. And
Any suggestions for us? What do you think? Anything we should include in our dating app, or do you think we should do something? Any suggestions? Any feedback?
Okay, I think whatever you are doing is pretty much you're trying your best. You are, you're contacting the lawyers and you're educating people. So that is
So you like the education part?
Education part is really wonderful. So I think more into it and it will be really great. I think also the education part is more important with your app. Why? Because people who will be signing up on this will be about 30-35.
Yes, that is our
Yeah. So the age factor over here matters because maybe people about 35 or 40 are not very used to this dating apps or open to the dating apps and they are not very familiar with the user interface basically. So I think this education part will help them more in terms of being okay with the idea of dating again, falling in love again, finding a companion again, and protecting
Thank you so
healthy
much. We
relationship.
will incorporate that.
Yeah.
Thank you so much for your time, Tanvi. It was really wonderful talking to you. Maybe we'll connect again in the future for some other projects as well.
Absolutely.
Thank
you so much for having me today.
With Rekindle Club, we bring in content for our previously married community, that is divorced, separated and widow. We tie up with industry veterans. We bring in curated content so that we make your life a little bit better. Do follow us on Instagram, Rekindle_Club. Download our app on Play Store and App Store. And if you know somebody who fits the bill, do forward this content. Stay tuned to Rekindle Club.